Today is day 3. Vaccinated Nova Scotians are beginning to get back to normal. With proof of vaccine, people are eating out, going to the gym, watching a hockey game in a full rink, or playing a sport themselves. Thank you to everyone for adapting and embracing the new rules that help to keep each and every one of us safe. I'm proud of the way Nova Scotians continue to follow public health guidance and continue to look out for one another. For the most part, I'm hearing good news stories. Actually, by far, that's what I'm hearing from Nova Scotians. However, there are those stories of some people being rude to staff, refusing to wear a mask, or even show their proof of vaccine. We all know how ridiculous this type of behavior is. If you don't want to wear your mask, if you don't want to get vaccinated, that's your choice. But your choice has ramifications, and there are no excuses for taking it out on anyone, particularly those that are just trying to do their job. Those of you who have gotten the vaccine have also made a choice. If you don't want to do the things that keep us all safe, just stay home. And if you're unhappy, feel free to flip me the bird when I'm walking down the street, or yell at me. But don't yell at the person that's just doing their job. Please take that out on us, but not them. The reality is this: Wave 4 is here. We're seeing what's happening across the country, and we need to make sure that it doesn't happen here. Our vaccination rates are good; they're increasing. They're where we need them to be. Where we need them to be before we knew about the Delta variant and what the Delta variant could do. But what we need to keep mindful of, as with all things during this pandemic, as with all things during this virus, the more we learn, the more we have to adapt. And that means we need to get our vaccination rates higher than what we initially anticipated. And that means we'll have to make some tough decisions along the way, continue to make tough decisions. So this week, the proof of vaccine policy came into effect. Last week, we announced mandatory vaccination for some groups. We've expanded it further this week. Covers, of course, nurses, continuing care assistants, teachers, correctional officers, early childhood educators, and all provincial public servants and others. We'll have until November 30th to get their vaccine. A couple of days ago, the legislature unanimously agreed to require MLAs to show proof of vaccine to enter provinces. If MLAs want to be in the legislature representing Nova Scotians, they have to be vaccinated. Now, I know that not everyone supports these public safety measures that we've taken, but this isn't about each of us as individuals. We have to think about what it takes to keep our community safe, our friends, our neighbours, our entire province. That's the Nova Scotian way. So if you haven't yet, please get vaccinated. And if you're deciding not to get vaccinated, that's your choice. But the consequences of your choice are clear to you as you're making that choice. So thank you to those Nova Scotians who've been vaccinated, and I encourage others to get vaccinated as well. Thank you, Tina. Thank you, Dr. Strang.
Thank you, Premier. Good afternoon, everyone. And I, too, want to express my deep sympathies to the family of the individual who was our latest unfortunate death from COVID. Today, I'm wearing the tie of the Canadian Navy Submarine Service in honor of Lieutenant Chris Saunders, who died October 6, 2004, as a result of the fire on board the HMCS Chicoutimi. I knew Chris, and he is a role model for all of us in placing others ahead of ourselves, in sacrificing to keep others safe. So let me start by talking about our epidemiology. We are averaging about 40 cases a day. It sounds like a lot, but it's largely what we expected. We're in a wave 4 driven by a highly contagious, easily transmissible variant strain of COVID-19. And so far, our situation is relatively stable, which is good news, but we all need to work together to keep it that way. We have some community spread, mostly in Metro Halifax, and most of the cases are in unvaccinated people, but everyone needs to be cautious and COVID safe in their daily lives in the days and weeks ahead, even if you're fully vaccinated. Today, almost 76% of Nova Scotians are fully vaccinated, and that number continues to grow. This means that we can handle a certain amount of COVID spread in the province with a limited risk of people becoming severely ill and our hospitals getting overwhelmed. But we cannot pretend we're not still in a pandemic. Just look at what's happening in New Brunswick. ICUs are full and they are now instituting lockdowns. We are in a good position right now, but if we let our guard down, things can change quickly. Our vaccination rates are high, but not high enough for the Delta variant. Everyone who can needs to get vaccinated, period. It is how we continue to keep each other safe. And we also need to keep doing all the safety measures we've been doing since day one of this pandemic. If you're feeling unwell, stay home and do the online or 811 screening to get advice on testing. And please do get tested if you've been exposed or have symptoms and are advised to do so. Continue to wash your hands frequently and wear your mask. And importantly, limit the number of close social contacts you have in your life. Even though we're opening up gatherings, our number of close social contacts should be small and consistent. And if at all possible, keep those to vaccinated people as your close social contacts. Let me address people's concerns about school cases. I know parents are worried about their children getting COVID, especially if they're too young to get vaccinated, and I understand that. Fortunately, for most children, COVID-19 is a mild illness, even with the Delta variant. In addition, our vaccination rates for children 12 and over are very high. Like everything with our COVID response, our approach to school cases is about balance. We need to balance the rare risk of severe illness in children with their overall well-being, which is impacted by not being in school. Our goal is to keep students learning in classrooms if at all possible. It's critical to their learning and their emotional, social, and psychological well-being. And this is especially true for elementary school ages, where online learning is much harder and social interactions are so important. Will we get cases in schools? Absolutely yes. If there is COVID in the community, it will also be in schools. But we are not at a point where we need to take extreme measures like closing schools. We have many layers of prevention. Staying home when sick, even with one single mild symptom if the person is unvaccinated. Getting tested, wearing masks, and increased public health measures at school when necessary are those layers of prevention. We're watching for widespread infections, and we have not yet seen that in a school, not even in a single classroom. Right now, we have 32 schools with COVID cases. 8 of them involve spread to another person within the school. And in all these 8 cases, this secondary transmission was within a single classroom and typically involves 1 or 2 other students. But there's been no schools where there has been a widespread within a classroom or spread beyond a single classroom. In some schools, there are multiple cases, but no spread within a classroom. And in these schools, we know that COVID is being introduced to a school in different ways from multiple points from the community, rather than being spread within the school or the classroom. So still, our experience throughout the pandemic, even right now in the 4th wave and what we're seeing currently in schools, is that the spread of COVID in the community poses the greatest risk to schools, that there is limited spread of COVID within the school environment, even when COVID is introduced into the school. If we have if we have 2 or more cases that are likely to be from transmission within a school, we do apply enhanced public health measures for that school. So we move them back to very similar to where we were in Wave 3, keeping to classroom cohorts, reducing non-essential activities, and increasing cleaning within the school. And where necessary, we support the school and the surrounding community with mobile testing and local vaccination opportunities. And we're doing that right now in the Fairview Clayton Park area. We will continue to see cases in the community and in schools throughout the fourth wave. High vaccination rate and mild symptoms in the vast majority of children means that we can have some tolerance for this. And I firmly believe that the risk of not being in school is greater than the risk of COVID. I believe that schools remain safe even though we may have some virus activity. But please be reassured, if public health feels that closing a school is necessary, we will not hesitate in collaboration with our education partners. In the meantime, please do not keep your kids out of school just because you're worried about COVID, unless you're directed to by public health. However, if your child is unwell, and again, even with one mild symptom if unvaccinated, please keep them home. We've had some schools where kids have been in school symptomatic for several days before they were actually taken to get tested. You can then to keep them at home, do the online self-assessment or call 811. And if you have a rapid testing kit from school, use it. If your child is told to stay home, please follow the public health advice and make sure they have a negative test before they can return to school. For at-home testing, as we announced last week, all students in pre-primary to grade 6 will be getting a take-home testing kit. Each kit contains 4 tests and detailed instructions. And this pilot program will make testing of people with kids who have symptoms more accessible, and it supports the early detection of COVID-19. As I said, as tests are distributed, which is starting today and will continue for several weeks, there'll be much more detailed information accompanying those packages of testing kits. And I do want to thank students and staff across Nova Scotia, especially those in impacted schools, for their hard work in keeping to the public health measures. As the Premier noted, the proof of full vaccination requirement came into effect on Monday. I've heard a lot of positive comments, and things are generally going very well. Many people are happy to be listening to live music or watching sports in full venues. Others appreciate the added safety of knowing everyone participating is vaccinated. Not everyone supports this, however, and we don't expect everyone to agree. But I do expect everyone to treat people with respect. And I'm very sorry that people in the frontline service industry are bearing the brunt of frustrations. This is not fair or appropriate. And I again ask everyone to be kind and compassionate to others. Businesses and organizations did not make these rules. They are enforcing the rules that we in government have put in place. I know many people are looking for the new standard format for Nova Scotia's proof of vaccination, the one with the QR code. And I'm pleased to hear that because of our VaxCheck NS app is ready later this month, a business or organization will be able to scan your code and get either a green confirmed or red sorry response. It will make things faster and easier, and that will be available in a few weeks. However, you do not need to have the version with a QR code today or ever. You can continue using the record that you got before without the QR code, even when we have the VaxCheck NS in place. And if your records are from another province or another country, that's fine. You will be able to keep using them as well. Permanent residents can also get their out-of-province doses added to their COVID-19 proof of vaccination, and more information of how to do this is on our coronavirus website. Lots of people are going to have different types of records, and as long as it has the key information to show you meet our definition of fully vaccinated, that's all you need. I do expect that there will be some challenges in this week and next week, especially as we implement things and people adapt to these new rules. And I want to thank everyone for their patience and commitment for keeping each other safe. And I'll close by just acknowledging we are heading into the Thanksgiving long weekend, and it is a time to be thankful. In many parts of our country, families cannot be together because of COVID. Yesterday, New Brunswick announced travel restrictions for the Moncton, Fredericton, and Edmonston regions. We asked Nova Scotians to respect the New Brunswick travel restrictions and avoid non-essential travel to these areas of our neighboring province. Thankfully, Nova Scotia is in a much different situation. We're not fully out of the pandemic, but we've come a long way, and we have much to be thankful for. This weekend, we can gather for dinner and visits with friends and family, but let's do that safely. If you're not vaccinated, please don't travel. And if you choose to do so, you need to follow the rules and isolate when you return if you've traveled out of province. And even if you are vaccinated and you're traveling this weekend, please remember COVID protocols and be cautious. Be mindful of indoor limits for informal gatherings. No more than 25 can gather indoors. And most importantly, if you're feeling unwell, don't attend events. Stay home or stay where you're at, away from other people. Family and connections are more important now than ever before. We've spent too much time apart during the pandemic. So enjoy your time together and maybe reach out to a neighbor or friend who is alone or isolated. Be caring and kind to everyone you cross paths with. Let's be collectively thankful for our blessings and the fact that we live in a place like Nova Scotia.
Thanks, Dr. Strang. Just a reminder, we'll take questions from the room first, and then we'll go to reporters on the phone line in the allotted time we have for today's briefing. Go ahead.
Was the intention always to roll out the mandate in parts by various groups? Was that by design? Is it more a function of some groups you were more ready to announce than others? Can you talk a little bit about that, please?
Bit of both, to be honest. It kind of evolved. Look, we want to keep as many Nova Scotians safe as possible. So our intention was to cover what we saw as kind of the absolute necessary groups from the beginning. But we knew that we'd be then, as we consulted and engaged and listened to the voices of Nova Scotians, that we'd probably be expanding it. And that's exactly what's happened, right? So on balance, I would say the feedback we've received from Nova Scotians, and certainly there are some that don't like the policy. I mean, we definitely hear from some of them. But on balance, the feedback we've received has been very positive, and in terms of people saying, I wish my sector was covered by that too, or I wish this was covered as well. So we wanted to get the policy out there. I think we signaled early on that we would be expanding it as we thought necessary, and that's what's happened.
Is that to say there could be further expansion, or from the province's standpoint, have you reached the threshold for as far as you are empowered to go?
I think we're pretty much there, and Dr. Strang may have something to add to that. But I would say, with what we've done provincially, coupled with what we're seeing happening from the federal government, some of the national things, I think a lot of Canadians are covered by this policy right now, and I think that's giving great comfort to the rest of us.
Does the province have the ability to extend it to municipal employees?
I don't actually know on that one.
Here's my position from public health. I think we've made sure that with our vaccine policy from government, we are covering those who work providing care or other types of supports to vulnerable populations, whether it's people doing health care, kids in school, a range of other community settings where people are living together. And that's important from a public health perspective. Where, as the Premier said today, the government is showing leadership as an employer and in instituting a vaccination policy as an employer. Those, along with our general proof of vaccine policy that many people are just saying, well, okay, if I want to go to restaurants and stuff, I'm going to get vaccinated. I think we're covering off the vulnerable populations and enough other vaccine policies that are going to get us to the vaccine level that we need to, but we certainly would encourage any other employer to take their own steps and create their own workplace policy.
You have both each said that the old 75% target is with Delta is too low and go by, but you haven't stated what a new target would be. Do you have a percentage that's a goal?
Well, I think we said many times that 75 was a minimum. And I've said many times here that that experts across the country have said with Delta, we need that you need to reach a target. They use the percent of eligible. They say 90%, and for us that would be roughly 80% of the entire population.
Dr. Strang, you spoke a bit about the concerns people have expressed about school cases. I may be misinformed, but I do believe there is one school that has a particularly high number of cases. So can you talk just a little more about how you and the folks in your office and the education department view what it would take to outright close a school depending on what it's dealing with vis-a-vis cases?
So even with the school that you're referring to, there really is no widespread COVID within a classroom. There's been 2 classrooms that have had some secondary transmission, but a very small percentage of students even within those classrooms. And there's been no spread beyond those classrooms. The 2 classrooms are related to separate introductions of virus into the school. So even in our most affected school, there is no evidence of widespread within a classroom, and certainly we have no schools at all where there's any evidence of widespread within a school. We will continue to watch carefully, and if we are seeing in this school or another school signs that there is increasing spread within the school, we will take further steps, which may go as far as closing the school. But even with that school in question, we in balance, I'm very comfortable that there is no need to close the school. Our education colleagues are of the same opinion. We've had conversations with education throughout the week. Today there was a conversation. One of my medical officers of health was involved with all the principals from the Halifax West family of schools, explaining that they're all very comfortable with the position we're landing right now with our schools.
With the numbers you mentioned, Dr. Strang, 32 schools with COVID-19 cases. You mentioned 8 of them. Is that 8 of them with spread of the virus within a classroom setting now?
Out of the 32, there's 8 which have what we say enhanced public health measures, where there's been evidence of transmission from one person to another within a classroom, and then we imply enhanced measures, which is really, as I said, going back to where we were in the 3rd wave with our overall in schools. But beyond that, even, as I said, even in the schools that are the most infected, we are not seeing substantive numbers of spread within a classroom and no evidence of all of general spread within the school.
But of these 8 classroom or 8 schools, then would we say there is then community transmission within the classroom? Is that
the majority of them? There's been one case. There's been one secondary case, or one child or a staff has spread it to another person. In a few circumstances, we've had more than one, but never more than 4. So the range of secondary cases within a classroom is usually 1 to 2, but the full range is from 1 to 4. And so we're not, if you look at the average size of a classroom, we're not seeing widespread within a classroom, and there's no spread at all between classrooms, into the general school.
This is our first example of potential spread within a school then. We didn't see a spread within schools, correct, in the 3rd wave?
We did have some spread within schools. That I think if we look at our overall, if I remember correctly, when we looked at our numbers after the 4th wave, about 4.5% of all our cases in the 3rd wave were related to likely transmission within a school.
For the parents of these students, whether they're in a school with transmission or not, you're saying don't keep your kids home unless you're directed by public health. What do you say to those parents? Obviously, some have been keeping their kids home. You must have heard from some who are worried about virus transmission. What do you say to reassure them, and are there any, I guess, negative consequences for keeping their kids home?
So I understand parents have that right to make that choice. But what we're trying to help parents understand as making that choice is that it's a balance. That there is a low risk of spread of the virus within a school, even when we know that there's virus at the school, and we have to balance that up with our clear understanding, and this has been reinforced repeatedly by our pediatric colleagues at the IWK, that the best place for children to be for their educational achievement, for their social emotional learning, for unfortunately too large of a number of kids, school is the secure place in their community for a meal, for some other supports. So there are significant harms if not having kids in school. So we have to balance that out with what is the risk of COVID, what are the risk of not having kids in school, and that's where we will always continue to reevaluate, but right, as I said today, very clear in our conclusion, and our education colleagues are right with us, that right now there is no schools that it is not the best choice to have kids remaining in school.
Dr. Strang, you spoke about the travel advisories that have been issued for New Brunswick. I believe there's quite a significant hockey tournament that's coming up in the Moncton area that draws folks from all over Atlantic Canada. Have you issued any type of guidance to Hockey Nova Scotia or anything else about whether or not folks ought to actually attend that tournament?
I had a conversation with a medical lead from Hockey Nova Scotia earlier this afternoon. Advised her around that we need to respect the New Brunswick travel advisory, and that going to a hockey tournament would not be considered, essential travel into the Moncton area where the tournament's being held. She was in complete agreement with that, and Hockey Nova Scotia will not be traveling to that tournament. We also know that Newfoundland is not sending a team as well.
Also, in terms of New Brunswick, this coming Thanksgiving weekend, it's my understanding yesterday at their press conference, New Brunswickers were directed not even to gather outside their household for Thanksgiving dinners. What do you say to Nova Scotians who are planning to go there for Thanksgiving? I mean, tons of people have family across the borders. How do you think that situation is going to go this weekend?
So I think, again, we need to look at what is New Brunswick Public Health asking people to do. They're saying in 3 areas of the province, zones 1, 3, and 5, which is really the Moncton area zone, Fredericton area zone and west, and then up in the Edmonston area. They're saying non-essential travel to and from those parts of the province. So my strong request to Nova Scotians is that we respect those, help New Brunswick out, don't travel to those areas right now unless it's essential, and that also helps protect us here in Nova Scotia from, there's certainly increased virus activity in those parts of New Brunswick, so it helps reduce the chance of the virus being brought back here as well.
Premier, you talked about this a bit last week when you announced the mandate for teachers and for healthcare workers, but do you have any concerns that this mandate now for the public service may result in services to the public being affected if a certain segment of folks decide not to go to work?
No, not anticipating any disruption of service. Certainly, we're always concerned, that there will be some people that just don't want to get vaccinated, and they feel so strongly that they don't want to get vaccinated that they'll put their own employment at risk. And we hope that that's a small number of people. But even to the extent that it's any number of people at all, I don't anticipate any disruption of service in Nova Scotians.
Dr. Strang, this morning,
A report was released about the outbreak of COVID at the Halifax Infirmary ward. I wonder if you have any comments on that. There were lessons that are supposed to be learned through that. I'm told, I haven't not been able to been confirmed, so I won't name it, but that there's been an outbreak today at another hospital. And do you have any thoughts on all of that?
So I'm aware of the report. I haven't seen the results of that report, so I can't really comment on that. I am not at all aware of an outbreak in a hospital in Nova Scotia. That has not been brought to my attention. And I'm very certain that it would have been if that is the case.
Dr. Strang, I'm wondering about the QR code scanners in the app, just if you could explain it a little more. You said it'll be green, confirmed, or red, sorry, response. So is this like a regular app? Is it a special scanner? Like, will my phone that scans QR codes be able to scan a QR code, say if I'm having a house party and want to check that my friends have been vaccinated?
Yeah, my understanding is, and I'm not a technically savvy very much, but it's an app that will be made available to businesses, to organizations, and they can upload it onto their phone that they have there, and then they can use that app to scan people's QR codes.
But not for the general public?
Not for the general public.
Mr. Premier, Dr. Strang, is there a timeline for perhaps entering a phase 5 part B once we reach that, say, 80 to 85% vaccination rate?
Maybe let Dr. Strang weigh in, but I mean,
So-
yeah, go ahead.
So I think I'm focused on wave 4. What do we need to have in place to keep us safe for wave 4? And I think what we're instituting are the necessary measures. That my belief and my hope is that we don't need to go further, but always reserve that if we have to. But I don't anticipate us sort of going and relaxing further with as you said, with a phase 5B or whatever. I think we need to have what we have and monitor carefully, and then we need to watch the epidemiology as we're coming out of the fourth wave, and what might we be able to then start to relax, as we've always done, slowly and carefully, as we emerge out of the fourth wave.
At the technical briefing last week, I may have misunderstood, but I thought there was some mention of the province giving scanners to businesses to use.
That was me I was corrected by my folks. That was me being not understanding the details of the program, my error.
No, it's good.
So like any old phone could use it, could work.
Yeah, any
Okay.
device. It's just an app that people that we'll make available. Our digital folks are working on the app that'll be made available in a limited fashion for those who need it, and they can use their own phones or whatever to upload the app.
Have you had any further conversations with the business community or heard any further evidence from them to suggest that they may need some level of financial support from you to help with staffing up to accommodate this stuff?
There's ongoing discussions. I'm not aware that there's any huge pressing needs. I mean, and just anecdotally, I mean, I've spoke to some people working in the service industry over the last few days, and they haven't indicated to me that there's been any major disruption. They already had a process. There's a little bit different process now, but my understanding and all the information I have says it's not been overly disruptive. We'll continue to monitor it. And just on the technology bit and the scanning bit, I think it's important to note that Dr. Strang started a major rush to lamination of the vaccine cards when he announced that his family had done that. I know certainly in my extended family, a lot of people rushed out to get the laminated ones as well, and those will still work. So you can use those at your house party when you have that, but I don't know about the app.
To that, again, the message that you don't have to have the QR code. We're getting lots of people worried about how do I download my QR code. What you have works now, and if you choose to use it, you can continue to use it. So we're going to require anybody to use the QR code. It just makes it more convenient. So
Dr. Strang, you said that 40 cases a day wasn't unexpected, and in a previous briefing, I think the last one, you had mentioned modeling, saying that this would kind of peter out towards the end of November, I think, or into December. I'm wondering if you can give us, can that modeling just be made public?
So that is federal modeling I'm referring to. We in my where I sit with other chief medical officers of health, the Public Health Agency of Canada has presented what they're modeling on what they anticipate the fourth wave will look like. So you'd have to approach them to get access to that modeling.
We'll go to the phone lines now and take some questions from the phone lines. We'll start with Keith Dutha from the Canadian Press. Go ahead, Keith.
Hi, one for Dr. Strang. I just wonder if there's any information or update on the potential for the booster shots for the wider population. Do you have any other information on that right now?
There's lots of conversation going on around booster doses. Waiting for, I know, National Advisory Committee on Immunization is convening next week to look at the evolving science on that. What I can say for certainly, as what we announced last week, so people with a specific definition of immune compromised, as well as people who had mixed schedules, so AstraZeneca then mRNA, and have to travel outside of Nova Scotia for work, they will be able to get for the immune compromised, their third dose in their primary series. For the travelers, a second mRNA dose of mRNA vaccine. They will be able to get that starting October 15th, and we will get more. There'll be more information coming out next week. We will continue to work nationally in the evolving science around where we might need to go further on booster doses. We are working within our long-term care sector now about how they roll out a booster dose of COVID vaccine along with flu vaccine for long-term care residents.
Go ahead, Keith, with your follow-up.
I'm wondering personally, though, based on what you know at this point and what you see is happening elsewhere, do you think it's fairly likely that will be the outcome, or you don't think that's a foregone conclusion at all?
So there's a number of issues. It's where is the science? There's a huge ethical overlay on that, is that even though there may be some incremental benefit of a third dose in Canada, is that the best use of a dose of vaccine when you look at it from a global perspective? There's lots of people who have had no access to vaccine at all. There's other provinces maybe moving ahead of where NACI is even, but based on their own epidemiology and what they feel their own needs are. So again, this is a rapidly evolving area, and it's complex in terms of the decision making.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Thank you very much. I'm wondering, Premier Houston, how you feel about, given what you've done with your provincial employees, how you feel about what HRM is doing, which is not mandating mandatory vaccine proof.
Yeah, I mean, we saw the decision, but and there was a question about whether we could extend to them as well. And I think where I'm at is we want more people to be vaccinated. I think we've been pretty clear. We want our vaccination rates to go up. And we've taken the steps as a province to capture as many people as we can in the vaccine policies. And I think we're at a place where we're comfortable with the steps we've taken. Do we wish others would follow along and support us? Yes, we do. I think that extends to individual employers of all kinds. But HRM made their decision, and I respect their right to make that decision. But I mean, it doesn't distract from the overall message that you're hearing from public health, Dr. Strang, myself, my team, is please get vaccinated if you're not vaccinated.
Go ahead, John, with your follow-up.
Dr. Strang, just to follow up to that, do you feel it makes epidemiological sense that HRM has taken this decision, given the fact that we have police officers and we have transit employees who are in direct contact every single day with at least dozens, if not hundreds of people?
So epidemiology is only one aspect that goes into making a decision. There's legal issues, there's labor relations issues. For me, the starting point is we know that across the board we have a good vaccine coverage rates in Nova Scotia, and that's a good starting point. We need to go higher, but making a decision about your policy vaccination, you have to consider a whole range of issues. So, like the Premier, every organization has to weigh those up and make their own decision, and we respect those decisions.
Next, we'll go to Sarah Plowman from CTV. Go ahead, Sarah.
I think this is for both of you. You talked about New Brunswick and what's happening. It is Thanksgiving. What's your message for New Brunswickers or who are thinking of coming to Nova Scotia, and for Nova Scotians who are thinking of hosting people from New Brunswick?
So I think the starting point is we maintain that our entry requirements, that if you're not fully vaccinated, you're going to have to isolate. And so remember that. The second point would be that if you're one of the areas of New Brunswick, that there is a travel advisory. That travel advisory is for travel not only to, but from those areas. So I hope New Brunswickers are listening to their public health officials, their government, and with good reason, moderating their travel based on those travel restrictions. And if their families are having conversations with family in New Brunswick about that, include those in your conversations about what is actually what is actually safe for a family and what they need to be thinking about as our kind of maritime or Atlantic collective approach, and how we need to work together to keep each other as safe as possible.
I think just what I'd add to that is I had discussions earlier in the week, different people casually asked me, did I anticipate any issues with traveling? And of course, with all things COVID, it's pretty hard to anticipate changes. So, I mean, as we sit here today, we in this province encourage, ask, use the other tools to motivate people to follow public health instructions. And just as we do that here, we do that for the other provinces as well. People should respect the public health guidance that in the area that they live.
Go ahead, Sarah, with your follow-up.
I'd like to extend a question previously asked to Dr. Strang to Premier Houston just regarding the investigation into the outbreak at the QE2. I'm not sure if you've had a chance to look at it and if you have any response.
No, I don't. Like Dr. Strang, I don't have any further information on that, and I'm certainly not aware of any other outbreaks as well.
Next, we'll go to Adrien Leblanc, Radio Canada. Go ahead, Adrian.
Thank you. Dr. Strang, you laid out the reasons why schools shouldn't close right now, but the teachers' union calls for a return to a circuit breaker approach, so just 1 or 2 days of closing affected school until the situation is under control, especially for parents who wonder if their children are at risk or not when they receive an advisory. Why not take this approach?
So first of all, we I guess are going to disagree that your language. I don't believe the situations are out of control. We have a limited spread, virus activity in a school that we take appropriate measures to keep it controlled. And it's not. We don't believe it's necessary, nor do our education colleagues, to close a school at this point in time. We're at a different place now with vaccination as a major factor than we were in previous waves. So we can take different measures because of where we're at, and the vaccines, create a very different dynamic for us when we look at schools. We don't look at schools in isolation. We look at schools as part of a community, and the role that vaccination plays in greatly creating a great layer of safety within a community.
Go ahead, Adrian, with your follow-up.
Thank you. And the union says also that in at least one school, sometimes only half of the students attend, and it is a major disruption. And maybe closing a school would allow teachers to switch to virtual learning. What do you think about that?
So I know education continues to monitor the attendance rates. They have dipped down, but they have increased again. And again, we will say that we encourage parents to have their children in school and follow public health and education advice. That if we feel it's necessary for your children not to be in school, you will hear from us.
Next, we'll go to Chelsea Gould from Saltwire. Go ahead, Chelsea.
Hi, Dr. Strang. So far, have there been any instances of businesses not complying with the proof of vaccine checks, and have there been any fines issued?
Not that I'm aware of. We talked with our compliance folks this morning, and they confirmed what we're hearing from businesses, that things are going very smoothly. We did hear about one business who was saying they weren't going to comply. They had a visit from our enforcement team where there was a good conversation, and now that business has committed that it will be in compliance.
Go ahead, Chelsea, with your follow-up.
Thank you. And I've heard some restaurants and fast food joints, they've just opted to close their dining rooms just to save the hassle. Have you heard any frustrations or feelings from people about having to do the vaccine check-in process at these places?
I haven't heard that as an issue. That's the right of fast food restaurant to modify their service based on what they feel is necessary for their operations. But I certainly have not heard any concerns raised to me about that.
That's all the time we have for the phone lines. We'll come back to the room for 2 more questions if you've got it.
Dr. Strang, do you feel like maybe the messaging from public health about the Delta variant and the fourth wave has perhaps made people, and in particular parents, overly fearful, and that they're keeping their kids home even when there's just sort of one case at a school?
Well, we're always trying to find the right balance. Throughout the whole pandemic, it's been about finding a balance of giving people information so they can take the appropriate action. We do need a certain level of, I don't going to use the word fear, of concern and taking this seriously. And that message, we've tried to adjust that throughout the pandemic. Have some people overreacted or underreacted? Probably, but I think I think we've done a reasonable job of finding that balanced message about having people take the right actions that keep each other and all us collectively safe, but not. We're always very cognizant about our messaging creating unnecessary fear and anxiety.
That's it. Go ahead, Premier, with your closing.
Thank you, Tina. And thank you, Dr. Strang. Thank you. Lots of questions about schools. I know people are concerned about cases in our schools as parents, as caregivers. It's our responsibility to worry about our children. So I certainly appreciate the questions and understand that people are concerned about COVID. But here's the thing that I would leave people with. I don't think Dr. Strang and his team have steered us wrong yet during this pandemic. So if they tell me, if they tell Nova Scotians it's safe for their kids to be in school, I trust that advice. And I'm asking Nova Scotians to trust it as well, because I believe Dr. Strang and his team have earned that trust. Our goal is to keep students in school. Our goal is to keep students safe, keep Nova Scotians safe. And closing schools is a last resort. But if it's deemed necessary by public health, if public health recommends that it has to be done, of course, schools will be closed. We all know, and the experts will tell us, that having kids in school, especially younger kids, is what is best for them socially and mentally. So the best thing we can do for all our kids in school is to keep the spread of COVID down in our communities overall. That means getting your vaccine, staying home if you're sick, and following the rules to keep everyone safe. So I just ask that you do what is required, do what you can do to protect the people around you who cannot protect themselves. So thank you very much.